Welcome to StallSide Podcast.
Bart, how's it going today?
It's going really well. How about you?
Yeah, good, thanks. Interesting guest on the show today.
Yeah, we do. Dr. Craig Lesser from our Podiatry department is going to join us today. And, Craig was, he was kind of raised here, came here for an internship and has been here and trained here. So it's good to have him. But he has a much deeper pedigree in veterinary medicine. We'll let him talk about that when he gets on.
Yeah, that's exactly right. I mean, he's definitely got it in his blood. Yeah, no, Craig's come a long way, and he is really focused on what he does.
Very focused and lots of ambition too.
Yep. Yeah, he's very driven. He's very driven to do a good job here. He's actually driven in his life, and he's sort of driven in organised veterinary medicine as well to sort of make the profession better for everybody. So he's going to be a great guest to have on the show.
He not only is he that he's an asset to our practice as well, and like you said, he'll be a great guest. Looking forward to talking to him.
Yeah, absolutely. So coming up next, we've got Dr. Craig Lesser from the Rood and Riddle Podiatry Service to talk about his insight on his days and all of the things he does. Dr. Lesser, welcome to StallSide.
Thanks for having me.
Yeah, it's great to have you here.
Yeah, thanks for coming in today. We appreciate it.
So Craig, tell us a little bit about yourself.
Well, I'm originally from upstate New York. I grew up with my parents, both equine veterinarians, so I really have no other marketable skills in life, so I decided to become a veterinarian myself. And then I went to Colorado State for vet school and undergrad and enjoyed my skiing time, and since then I've kind of been on an adventure of where I'm going to go in life, and it's taking me to podiatry full time. So.
Your parents did a good job if you still wanted to be a veterinarian after living with you. See, my kids only had one veterinary parent, and they want nothing to do with it.
Yeah, I mean, I could sort of see why that might be a bit of a disincentive.
So it was,
my brother tells me all the time, why would I want to work with sick animals when I can work with healthy animals? So he decided to become a farmer and rancher.
There you go. Yeah. So the move from upstate New York to Colorado, what drove that? I mean, that's a good move. But I mean, what took you to Colorado?
Well, as you guys know, the veterinary community is a really tiny community, and we walked into Torrey Cornell, and my dad walked up to the dean and gave him a hug, and I decided that I needed to go somewhere else that I could get away from my family bubble a little bit.
Yeah.
So I drove all the way across the country to Colorado, and my first day there, my dad calls me up and goes, "Hey, one of my classmates is one of your professors. You should go say hi." So I drove halfway across the country, and I didn't get out of his bubble because it's such a small group.
Yeah, so, parents ruining their children's opportunities for generations. So talk a bit about your day. What interests you? What do you like to do?
So I do all podiatry. So basically, if it's above the fetlock, I don't really deal with it anymore. So I got into this because I wanted to do sport horse, and I just kept running into issues dealing with feet because of lameness. I had a little bit of farrier background and decided to jump a little bit further. So I do everything from lame sport horses to a lot of chronic laminitis broodmares, and the foals is probably my favorite part of it. These are the ones we can actually make an improvement on for the rest of their life. So it can be everything from a bad abscess where we have to do surgery to acute laminitis horse where we're doing a lot of medicine in addition to mechanics, to just a few crooked foals here and there that we have to just helpfully straighten out a little bit.
Yeah, I think one of the greatest things about working here is having the podiatry service to actually help us, but also have an input with. And you mentioned foals, and some of these foals come in and their legs go to the 4 points of the compass, and we get you guys involved in, and it's just amazing how time and the technique that you guys put into them can just transform these foals. So would you like to expand on that a little bit?
Yeah, so I put together just a few slides and about some of the things that I look at in foals. I'm not doing the medicine side of things. I'm purely looking at structure and function. So kind of the biggest things I'm seeing in newborns is laxities and contractures. So whether their deep digital flexor tendon and their superficial flexor tendon are a little bit lax, or whether they're a little bit too tight. And then we try to do things to help compensate for that and help the laxity strengthen up and the contractures relax a little bit. So here's kind of a photo of a contracture, and this is a foal, and each image is an additional day. So the first day he wouldn't even put his foot on the ground. We were able to put a splint on there. The next day he could actually put his foot down, and on the third day he's actually putting his whole foot flat on the ground, and he's doing great. And we do this with some human splinting material. Traditionally we would use PVC pipes, and then the horses would end up having these rubs on them, and then they have white hairs, and nobody wants white hairs on the horse to begin with, but especially for our thoroughbreds, we don't want that at the sales. So these splints, they form beautifully to the horse's leg. We're able to slowly stretch everything out and get them back to the normal conformation that we want for that horse. So one of the big things with these, though, is that another way people are treating them was with toe extensions, and we tried to go away from that. When I first came here, probably every year I would see a foundered foal, and those foundered foals are some of the toughest cases you'll see. We rarely have luck with those young horses that have foundered, and I'm talking, within the first month of age, just because they've mechanically just been so destroyed down there.
Yeah, that's a really catastrophic thing. I mean, because they'll just lose their hoof capsule. And you mentioned deep digital flexure contracture. I mean, those are the ones I just sort of see that are absolutely the hardest to straighten out because you can't get any leverage on them. How do you manage those deep digital flexure contractures? Because that really pulls the toe in. Yeah,
so the nice part about the splinting material that we use is we're able to wrap it around the toe and give a little bit of upward pressure on it, and that constant pressure will stretch out, just like if you're doing your normal stretches. It's if you just stretch once, it's not going to get you anywhere, but if you stretch consistently over time, you're going to get everything stretched back out again. And these splinting materials, because they can wrap, it allows us to get that extra leverage.
Yeah, you lost me at stretching because that's exercise. But I take your point. I mean, when we get you guys involved, it's a progressive thing, and I think that's the thing that needs to be impressed upon people that own these foals, is that there is no overnight fix, and you just have to progressively stretch these things out. And I must admit, I'm amazed at what can get done. I mean, some of these foals you look at and sort of think, this will never straighten. And as I say, tincture of time and the mechanics that are put on there, it's impressive what can be saved. What else do you have to show us today with the foals? Well,
so the opposite of our contracture is our laxities. And we see some pretty severe laxities. So this is a pretty mild laxity you're seeing here. And between the two trims, we see some improvement. When foals are born, their heels are really underrun, and they go out there and they run around and they wear those heels back to a normal position, and they are able to use those limbs properly. But if foals are restricted for some reason, or they're out in our nice, beautiful, soft fields and not wearing our feet down quite as well as they should, sometimes a little trim will help them move in the right direction to mechanically stabilize. But if it's more severe, like something like this, we need to really intervene and help this one out. This horse is walking on its heels, its fetlocks touching the ground. You see these big rubs on them. So this horse can't go out. This horse is getting these rubs sitting in stall. This was actually, it was down most of the time because it wasn't strong enough to stand up with its weak legs. So we do a lot of shoeing to help these. And here's an immediate before and after we applied some shoes. It's pretty incredible just getting that foot to sit on the ground, a little bit of a heel extension out there, and this horse will be now set up to mechanically use its limb properly. And if it's using it properly, the muscles will develop properly, and then we'll be able to remove this extra shoe that we added to the foot.
No, that's a good point, because the laxities they're gonna come around eventually. But it's protecting that foal, protecting those sensitive structures, because they will wear right through the back of the fetlock in no time if they're allowed to. Because I've seen foals toes pointing right in the air, and the fetlocks are right on the ground. But getting those shoes on makes a dramatic difference, and it's just a matter of giving them time to straighten up, strengthen up, and be able to be on their own. Yeah, and that's some of the problems we have with some of the more devitalized foals that we have that are very lax. And it's great, you come and put the heel extensions on, and we get, like an immediate raise, which is good because it protects, the back of the fetlock like Bart's talking about. But we're really compromised because they're in a stall or they're on a bed and they're not loading their legs properly. So if you had a situation where you had a foal that, say, had a little bit of laxity, you're on the farm, what do you recommend for people to do as far as exercise and stall confinement goes? I mean, we don't want them to go out too much, but we also need a reasonable amount of exercise. So talk to me like I'm your client. I have this foal,
fetlocks are on the ground. Walk me through how you want me to manage this foal to help you get the best out of what you've done.
Yeah, so for the first, I can't put a shoe on until 7 to 10 days of age. So if the fetlocks are truly on the ground, unfortunately for that first week or so, we are on pre or stall rest, because otherwise you walk them down a concrete floor and you're going to tear that poor skin apart. But once we get something on there to protect us, and I can't bandage it because bandaging causes further laxity, so I have to have a different type of protection. But once we get to old enough I can put a shoe on there, I like to start hand walking. And just like with most rehab, it's dependent on every horse is a little bit different. So I start with just walking up and down the aisleway once. Then I start doing 5 minutes of walking, and then slowly increase until we can spend an hour or two out in a cage, and then hopefully out into a paddock. I usually don't go past a paddock with these guys that are pretty lax, just because we can have some issues. We can have some sesamoid issues. We can have just some soft tissue injuries in general. So usually it's a stepwise progression, all dependent on how well they're doing and how well they're responding to therapy.
That's a great point you touched on, because putting these mechanics on, by altering one thing, you must be stressing something else. So what are the things you look for with these foals, say these heel extensions on? What are your warning signs that this isn't going to go right?
So on some of those, you'll start seeing the hoof capsule will start to distort a little bit. We're putting a lot of extra forces on this capsule to compensate for the entire leg. So you will sometimes get this stress ring on the hoof capsule, which is a worry. The other thing, sometimes we get some quarter cracks in these little guys, which none of these things are the end of the world, but it's showing the stress on the hoof that is being taken away from that poor limb structure.
But with the heel extensions, you're more pulling the toe down rather than pulling the toe up, which was the problem with the contractures.
Yeah, so
it's a little more natural, I think. But
yeah, and we don't see any real long-term problems from those. If we pop a quarter crack, honestly, I take the shoes off, I give us a week off, and then we put them back on again once we've grown a little bit in new wall, and we do great usually. So
but if you haven't had those heel extensions, they stick out quite a ways. Did mares just step on them? Do you have problems with anything like that? Getting stuck in the stall door?
It occasionally we blame them on mares stepping them off, but I think we're getting better at them, and it's not happening as much as it used to. There's some newer products on the market that don't stick out quite as far, but still give you the stability that we need. So I think it's not something that I worry about at all.
Okay.
Yeah, I'm very impressed by the materials you use, like the bonding agents. It just impresses me, the material science that's gone in there to actually get these things to stick onto this hoof, because when you look at it, it's not exactly an easy surface to glue anything onto, yet these things stay on.
Well, but my life is basically just an arts and crafts project.
We're going to see you on Etsy.
Yeah, pretty much.
Yeah. Moving on from the foals, sometimes you'll have an older horse that has some pretty severe infections. And how do you approach those? And what adjunctive therapies can you use besides the usual just curate it out, put it on antibacterials? What other novel things do you deploy to try to help those horses?
Well, when I start seeing a horse that's either been a chronic abscessor or chronically lame, we obviously start with radiographs. And there's a variety of things we're looking for on those radiographs. Is there a foreign object in there? Is there some sort of bone disease? Is there a piece of cancer in there that might be causing some pressure necrosis? So once we figure out what's going on, we can better determine what we're trying to fight. So in this photo, you can see that there's this big abscess tract going up this foot, and it's actually gone into the bone here. So this is septic pielosteitis. So there's a big infection, not only in the soft tissue like a normal abscess, but into the bone itself. And traditionally, you go in there and you scrape away at the bone, and the horse is severely lame for a few weeks. We're on heavy-duty antibiotics, which we're trying to avoid some because of resistance issues. And then we're going to be off for the next month or two as this grows out. And that can be really frustrating at times. So we've kind of searched for newer options, and one of my favorite things to do, and what we do quite a bit, is larval therapy, which is the nice way of saying we put maggots in the foot. So this foot here, we put some maggots in there, and they go in and they eat only the dead and infected tissue. So instead of me surgically debriding it, they debride it for me. They only take away what's bad, and then this horse honestly will be sound in 3 days versus 3 weeks or longer if we have to do surgery.
So what different? What are they? How does that happen? What difference are they making in there?
So they go in there and they actually eat the dead and infected tissue. They are supposedly release an enzyme as well that's supposed to help with granulation tissue formation and speed up the healing process in general. They're gonna remove all of that exudate from the wound, so the wound will have a better chance to heal a little bit faster. And I have some friends that not only we use them in feet quite a bit, but I have some friends that have used them in fish-related withers, chronic infections, and tendon sheaths that are draining infections. So I've had some friends that have gotten a little creative using them too on other areas of the horse.
It's quite strange how things come around again, right?
Isn't it amazing?
This is like battlefield medicine,
Well,
Civil War stuff.
that's what it is, actually. Yeah. So it initially started where soldiers that were shot and they came into camp a few days later, they found out the ones that had maggots in their wounds were more likely to, or were less likely to develop gangrene than the soldiers that did not have maggots in their wounds. So we might as well start putting maggots in, and then it just sort of developed into a therapy. And I think in humans, it's used mostly with burn victims. Your skin's this biggest organ, so they use them to just debride the skin on some people do on some of those really bad burns.
Yeah, thanks for the video. I wasn't going to have rice for dinner, but I'm not sure.
Yeah, that's...
it gets back to a food analogy that somehow or other...
it can be a little unnerving. Right?
Yeah, but this is the thing. I mean, I just think it's great. I mean, this is actually like applied science. And, there is a lot of very impressive biology that's going on with larval therapy. So, yeah, I mean, I'm all that. And it's done some amazing things. Like when we manage these cases in the hospital, we have the treatment plate on, take the treatment plate off, and there are the maggots, right? And they're just doing the job, and everything's pink and healthy and bleeding where these maggots are. And this was dead tissue that wasn't going anywhere, and they just debride it all back. And they don't have to get paid.
No, they get through. They grow. It's amazing how much they grow.
Yeah.
You pull that plate off, and they're a lot bigger than when you started.
Yeah, they've done their job. They don't need a pension.
So never any worry about them getting into healthy tissue and
not this type of maggots. There's other ones that will eat healthy tissue, but this type only eats dead and infected tissue. So we're not worrying about our fly strike or other issues like that you sometimes see in other animals.
Yeah, and these are actually special. They're not just like garden variety.
Yeah, no,
these are medical grade maggots, and people need to realize that these are actually an expensive proposition to actually get these, because these are grown in a sterile environment.
Yeah, they are. But we've looked at the flip side of it. The other way we'd be treating this is with multiple regional lymph perfusions, which gets really expensive. You're going to be 3 to 5 vet visits. So instead of us doing this once, and then we are all covered for all bacteria, not just whatever that antibiotic was sensitive to. So. Yeah.
And it's far less invasive than the regional lymph perfusions and other things.
And that's a fantastic point too, because the pressure is on is to cut antibacterial use, since we're going to treat the whole horse to try to treat this little piece of bone, and we all know when that goes wrong. And so this is actually much more rational therapy, and actually is conforming to what we're trying to drive towards in medicine, is that less use of antibacterials and reserving the high-powered ones for reserved conditions, because some of these bacteria you grow out of these pedal osteitis or these other orthopedic conditions, they are multiply resistant, very tenacious bacteria, but they don't survive a maggot.
Yeah. Did you have a video of the maggots? I missed that. Did you? No?
Oh, I just played it.
Sure. You just played it. All right. Well, if you're watching on YouTube, you got to see it. That's great.
That's
I missed it.
Yeah,
I'll have to watch the show.
You'll have to watch the show.
It's just crawling all over the place. Yeah, it's pretty great.
Yeah. But hey,
clients usually give me a call back after their first or second bandage change, because they grow so much, and they fall out and all over their hands. And
I try and catch the little suckers and get them back in there.
Oh my goodness. Okay. What else? You're talking about these bony infections. What before then, like laminitic change? How do you manage those cases when you have these severe laminitis? Because, this can result from that. So stepping back from that, how do you try to stop them getting to the point where they have that bony loss?
In a laminitis case, honestly, early intervention is the biggest thing. Especially, a lot of our horses are slightly overweight. They have some of these signs that they might have some underlying metabolic issues, but they're never really having a big flare. We love them, so we keep feeding them more sugary treats. And, they might get to the point where they get a little sensitive walking over rocks, or maybe they're a little tender post trimming, not because your farrier trimmed too short, just because that's how they are. Those horses are a lot of times in this subclinical chronic laminitis state. So those are horses I really encourage you to have your veterinarian come take a look at. And get some baseline radiographs. In all reality, it's really nice for me to have baseline radiographs from the past, because some horses carry rotation, and that's normal. But if they show up to me because they're going through an acute episode and I see rotation, I'm a lot more worried than if I knew that was the normal state for this horse. So really being aggressive, not only with having radiographs beforehand, but once we first start seeing these signs of pain, really getting mechanics on the foot and anti-inflammatories inside.
Yeah, I think it's actually quite common, these horses, you're talking about the subclinical metabolic situation, whether insulin resistance or whether they're actually Cushing or driving insulin resistance. It's surprisingly common, and it's really difficult to diagnose by standard laboratory testing. And sometimes you just got to go on the iometer, right? So when you look at these horses, if someone just presents you a horse like you described, what are the things that you look at in that horse without the benefit of laboratory testing? What do you look for? What changes in that hoof capsule, the way it grows? What gets you in the mind that this horse may have underlying insulin resistance?
Yeah, so just starting with my basic exam of the foot, and I do this for all horses, is I watch the horse move, and I get down on my knees and I palpate the coronary bands. I'm feeling for ledging. I'm looking at the hoof wall. Are there any rings on the hoof wall? Is there faster growth in the heels than in the toe, or the inside versus the outside? Do we have any pulses? And then using hoof testers. Is there some areas that are sensitive? So that's just the foot itself. But then once I've done my exam of the foot, I have to take a question back. If there's some signs of maybe there is some chronic laminitis, I take a step back and I look at the entire horse. And does this horse maybe have a little bit of a crusty neck? Is it middle of summertime and we have a little bit more hair coat than I want to see? That's when I realize that, we need to treat this underlying metabolic condition in addition to dealing with the foot, because some of my most frustrating cases are horses that we mechanically stabilize the foot, but we can't or there's not great compliance with getting the metabolic side under control, and we keep going through episodes of laminitis because the cause of the laminitis was never stopped and prevented.
Yeah. All diets are hard.
Tell me about it.
No, seriously, all diets are hard. And that's the problem I have with clients too, is that, they look at me and they've got to see the horse every meal time. When the horse looks at them wondering, what have I done to you to deserve this?
Like Mrs. Pumphrey and Tricky Woo, right?
But so I get them to weigh the hay. Weigh the hay dry, just head on down, both have a little fishing scale and just weigh the hay. And people get shocked when they see how little or how much more they were feeding the horse than what it needed. And usually they're feeding it way too much. And it says, how much do you have? Oh, just a couple of squares. Well, you know how a square of hay depends on how fast the balers are getting driven.
Right. Yeah, no, it's true.
It's exactly right. And so sometimes the square is huge. They're hugely overfeeding these horses, and then you start to weigh it, and then you start to get some discipline in the diet and take the weight off. And all of a sudden, we have a horse that goes to you guys and, hey, we're making progress. This horse is not sore anymore. The horse has lost weight, and get back to the horse where it actually has good quality of life and has great function.
Especially ponies.
Yeah.
In ponies, it's not if they founder, it's when and how badly. And a lot of it's based on nutrition, because we feed them like horses, and they don't need to be fed like horses.
And they'll eat like horses.
Yep. Yeah. Oh, yeah. It's amazing what ponies can eat.
Yeah.
I don't know where they put it. Well, I know where they put it. I know where it ends up. But this is how can they eat so much? But when you think about ponies, a lot of those little small compact breeds, they were selected for that size, and they evolved in environments or selected environments where nutrition was actually sparse. Now it's sort of like there's a fast food joint on every corner for these horses, and so food is love, and we love our horses, and so we just keep feeding them, and look what happens. Yeah. So tell me about a day for Craig Lesser. How do you start off? What happens during your day? What captures your attention?
I start at my place taking care of my critters, and then we usually meet up at our first stop about 7:30, and depending on the day, we will see a lot of chronic laminitis horses. We're in central Kentucky. There's a lot of brood mares here, and a lot of them have sore feet. So we'll see a lot of chronic laminitis. And the coolest part about my job is I can take a horse hopefully take a horse that's pretty sore, work on it, and then it walks off more comfortable. And that instant gratification, I am a millennial, so I like my instant gratification. It is really nice to see when working on horses. And then, from there, I might go, my next stop might be a lame horse, and we might be taking some radiographs of his feet and opening some abscesses, might be using our larval therapy, or might be doing surgery. So if we have a bad laminitis case that comes in that's uncontrolled with mechanics, we might be doing tenotomies to help align the bony column and hopefully reperfuse the foot and get that horse back to a comfortable state. It's one of the coolest parts about my job is I only plan about an hour out because I have so many add-ons throughout the day, which can be frustrating, but I don't know what I'm going to see next, and it can be a whole wide variety of things. It's pretty exciting.
You touched on something that is quite difficult, I think, for clients to get their mind around when you're treating these badly laminitic horses, tenotomy. So talk a little bit about the procedure and what the goals are. Mechanically, what are you trying to do to that hoof to make things better by doing that tenotomy?
Yeah, so when a horse founders or goes through rotational laminitis, what happens is the lamina, which is what holds the bone in the hoof capsule, get weakened. And there's a force that pulls directly against that, which is the deep digital flexor tendon. And it pulls under a constant tension. So when the lamina is weakened and it still has that same tension on it, what happens is it breaks down and we rotate. So I need to stop that from rotating. And the only way to do that is to remove the tension of our deep. So in not as severe cases, we're wedging feet up, we're trying mechanics, but in cases that doesn't work, or honestly, if the coffin bone has come through the bottom of the foot, we reach for a procedure called a deep digital flexor tendon tenotomy. And here's a case that had pretty severe rotation. This horse was prolapsed through its shoe. If it didn't have the shoe on, it was an oval grade 3 to 4, which basically means it laid down a lot and wouldn't let you lift up one leg at a time. And we needed to figure out what to do for this horse. So we went ahead and not only did we reduce the tension of that tendon, but we completely cut it in half. So now only two forces acting on this hoof are going to be the weight of the horse coming down and then the ground pushing back up against it. So we're able to remove some of that rotational forces, and then we can go ahead and we can realign everything. So that hopefully, once it's all realigned, we can start growing new healthy wall parallel to where the bone is. So all this growth up top here is new healthy growth. And it's parallel to the hoof wall, and that capsule is going to grow out really healthy again in the future. So it's a very invasive procedure, but it can save some of these lives of horses, and horses can have a nice healthy life after the fact. It does take a full year to grow out a hoof capsule, though, unfortunately. The surgery is very simple and straightforward. It's a small incision into the cannon region of the horse, and we take two little butter knives and we slip it around the deep digital flexor tendon to isolate it, and we cut it and we suture it back up. It honestly takes longer to block and prep the leg than it does to do the surgery. Shoeing aftercare can get pretty intensive, but the procedure itself is, it's a surgery, but it's done standing, and it has some pretty incredible success.
Yeah, I think it really emphasizes the importance of radiographs, because when you look at this laminitic hoof and you see how the toes got really long, you don't really appreciate where the pedal bone is in relation to the toe and how much you have to cut that back and realign it. And as you say, the goal is to get that hoof wall growing parallel to that pedal bone, because they are so messed up.
Well, you're right, because when you see those pictures, how long that toe is, and just imagine the leverage.
Oh, yeah.
It's in there.
It's painful, and you're actually making that worse by just, as you say, the leverage on that point. It must be just so painful. And I'm very impressed by the instant relief some of these horses get.
Oh, it's wonderful.
When you do this, it's just you cut the tendon, all of a sudden the horses, the pain's gone, because it's not got that constant tearing of the lamina from the tension that's on that. So it's an impressive technique.
Long term, what I've seen, they flip their toe just a little bit, and they don't walk completely normal, but they're comfortable in the pasture.
Yeah, and then that's, I start with a conversation with all owners of when we deal with laminitis is this is a chronic disease of life. This is something that we're going to be dealing with, and as long as you're willing to keep going forward with it and your horse is willing to keep going forward with it, I'm going to go with you guys. But as soon as that horse says we're done, we're done. Mm-hmm. And there's no question. I'm supposed to be the advocate for the horse, and I will be. And as long as there's that light at the end of the tunnel, it's pretty incredible what these horses can come back from. It's really wonderful.
Oh, yeah, absolutely. I mean, there's been cases that nothing else would get them right, and you cut the tendons, and all of a sudden this is, it walks a little bit differently, but the quality of life this horse has, it's out there charging around the paddock, and it's fine. And he says, wow, that was impressive, but, I mean, I think it is pick your cases and don't wait too long. I think that would be fair, wouldn't it?
Yeah, well, and if you wait too long, you start getting bone changes. And, here's a foot of a chronic laminitis foot that has quite a bit of bone change to it. And with all of our cases, it's so much harder once the bone has remodeled, because that means the vascular supply is remodeled, and that means that we're not going to get us back to that original healthy state. And if you look at this foot, you see on our left there, the capsule is distorted, but on our right, you can see the bone really has this big tip to it. And what I said about the blood supply remodeling, look at the blood supply. It's coming up here, it's kind of remodeled to the foot, and this is a venogram, so we're looking at the blood supply here. And then we're also just there's no blood vessels here versus this other image where we're pick the leg up. There's all sorts of blood supply there. So this horse, if we can mimic this non-weight bearing state, we can make this horse more comfortable. But since we have all these major changes, we're never going to get this horse back to being an athlete or anything like that. So, that just comes back to being really proactive and getting these horses looked at right away before there's any changes.
Yeah, this is a very visual episode of the podcast, so I'd absolutely recommend people get on YouTube. But that change in the vascular supply, I mean, when you do the venograms, that's impressive because you can just sort of say, hey, the blood is not going here. There's no blood, not going to grow. And if it doesn't grow,
it's going to die.
It's going to die.
We're going to have to do larval therapy.
You're going to have to do larval therapy at least.
At least, yeah.
So what does the future hold for Craig Lesser?
Well, I've recently become a shareholder here, so I'm with Rood and Riddle for life at this point. So I've made Kentucky my home. I recently bought a farm in town here, and I am getting married in a little over a year. So no, life is wonderful in Kentucky. I'm really enjoying it here.
There's a lot of
things. Those are three things. You're going to have to keep your head down. There's a lot of weed eating in your future.
Yeah, that's right. I just sort of see, there's Craig.
I don't sleep
very
remember
much. Craig when.
keep the wife, the farm, and the practice all happy. Yeah. Probably in that order, I guess.
Yeah, that would probably be right. Yeah, so he'll be a little bit stooped in a year or so as he walks along, looking at the ground, shuffle his feet, won't make eye contact. It was nice knowing you before, Craig. It really was. Yeah. That's fascinating stuff, Craig. You guys, it's just science and art married, and they had a baby. It's just what you do is just so skilled and so arty.
No, I think in my career, I think I've said this before, that podiatry is probably the one advance that I have seen in my practice that's saved more animals than any other. Just the stuff we're saving now that we couldn't before, and the pain relief that we can give the horses, it's very gratifying.
Yeah, and it's come along relatively late in the piece, right? Because, we've all struggled early in our careers with these horses that we just really didn't have any other options. You could pop a shoe on them. But that wasn't enough. And now all of a sudden there's this discipline that says, hey, look at all the things we can do. Larval therapy, right? I mean, that's just pulling something from the past and putting it into the future. And it's just a great application of knowledge that was to actually do things now.
Things that fascinates me most about my job is this is, for me, the specialty in veterinary medicine that there's the least number of facts about. It's still so much an art. We're learning so much every day. And being here, I get to learn from all the different departments, but within my department as well. And we get to try new things. And if it works, that's great. If it doesn't work, we're going to pivot and try something else.
Well, Craig, this has been fascinating. It really has.
Yeah, appreciate you being here. It's always a lot of fun to talk about, and you guys do some great work, and it's very appreciated. And your ambition here is always been very welcome too.
Well, thanks for having me, guys. It's been great.
Yeah, I like calling you about 4:30 in the afternoon. to sort of say, hey, come bail me out.
Well, I don't want to visit you before that because it's usually down in isolation anyway.
Yeah,
so.
that is true. Unfortunately, that's one of the things is that a lot of roads lead to laminitis, and it's just glad that you guys are there at the intersection to help us out, because we used to we'd get them over the primary condition and we would lose them because of what had been set in motion with the hoof. And now all of a sudden there's somebody to say, hey, I can help you on that. And that's actually made a big difference to the running of this hospital. Excellent. So we've been with Dr. Craig Lesser from the Podiatry Service at Rood and Riddle, talking about his career and his insights on foals, larval therapy, and laminitis. See you next time.